What the heck? Hey, everybody. Hey, Dr. Ojo Karens. It's been a minute.
Hey, Hannah.
How you
It's been
doing?
a hot minute.
Yeah.
I can give you, so do you want me to give you the usual way that we ladies answer that question? Or do you want me to tell you how I'm doing?
This whole thing is about real talk. So, real talk, can you lower your Instagram, your camera, so that we can see more of your
Oh,
pretty face on the Instagram?
yeah.
Yeah. And then lay it on us. What's the scoop?
Oh, I've had a day. I have had a day.
Mm-hmm.
I've had a day. So I am here. I am present, and I am being real. I have my hair wrap on because I've had a day. But I'm good. I'm okay.
Get out of here.
I'm
We don't
fine.
want that. Yes,
As I'm
obviously you
crushing
can
and
handle it
melting
and you're
inside.
fine. Yeah,
Oh, I'm
right.
good. I'm fine.
But look, thanks for being here. Last week it was my fault. I had a kiddo with an ear infection, so thanks for bumping it to this week. And sorry, you guys, for missing it. But tonight we're doing Q&A. We've covered a lot of ground. We've talked about a lot of things. I reached out to some of my friends and I said, "What questions do you have?" And they said, I feel really well informed because I've watched a bunch of the ones that you've had. So low libido, you've covered discharge, so if there's some of these topics we've covered, so go check the YouTube channel and check them out. But if you're here with us now and don't feel ashamed to send in your questions, yeah, see, it's all good. Love the real. This is what people are here for. This is not the pretty shiny. This is the real Wednesday night wind down.
The Wednesday night wind down. Yeah, the real can sometimes be scary, but it's real. And we all go through it. So let's share it together. I've had a tough day. In fact, I've had a tough week and I've had a very challenging month, but I am here. I am present. I am happy to be here. And thank you for asking me. And thank you for giving me the opportunity to really say how I'm doing. That's what we should all do for each other.
And you know what? You also opened up a business in a pandemic. So, I mean, we could go back and say it's been a challenging year.
Yeah, that's true. That is very true.
Ups and downs, though.
Ups and downs, but you know what? We move forward. So, and we embrace the downs, like you embrace the ups. So you're happy about the up, embrace the downs because there's something to learn there too.
Mm-hmm. Yeah. It's hard to see the sunshine if you haven't had the clouds.
And you're right. You're right. For those who are joined us, Hannah and I, we stayed backstage and we chat before, and I said to her, sometimes I wish I wasn't as optimistic because I wouldn't see the bright side of things and make decisions based off of hopes and then be in the middle of challenges. But it is good to have an optimistic side and look at the bright side. And if you can't, try and speak to people who are optimistic and who look at the bright side to pull you out of that mire, out of that pit.
Mm-hmm.
Yeah.
So I've got a question for you and for anybody who's here with us tonight. I call it candy, but it could be like anything that's giving you life right now. So if you're listening and you're with us, I want to know what is spurring you on. What's that little spark of joy? If you get that moment to yourself, what do you do to fill your cup? So as we go, I want to know that from listeners, but Dr. Ojo Karens, what's the thing for you? What's your candy right now?
I have been listening to the Bridgerton series. Yes, I watched it on Netflix, as most of you. I've watched it a couple of times on Netflix. And it's Netflix, right? Which
I think so, yeah.
service? Yes.
Yeah.
So I have started to listen to the books, and that is giving me such life. I'm enjoying that. And I've also I've fallen in love again with Nora Jones. I've rediscovered her again. You know, I
Mm-hmm.
would always come back to her. So just listening to her music. Those two
Mm-hmm.
things have been giving me life in this last week and a half.
Ooh, that's so good because Bridgerton, when it came out, it was just like a in the winter, here's a drop of joy for everybody. And man, was it good. So
It was
good
so
and what I
good.
needed. I'm glad to know that the book's good and I'm glad to know that you can listen to it.
The book is just magical. And yeah, it was a drop of brightness, like all the colors, all of people, all the colors of costumes. Um, it was just wonderful. And I have moved right into the book and have enjoyed that just as well.
Mhm. Mhm. Nice to have the strong visual in your head as you hear the book, I'm sure.
Yeah. What about you?
Okay, so I am a diehard Office fan. The Office, the TV show
Uh-huh.
The Office. And
Uh-huh.
there are two podcasts. One I think is good and one I think is terrible, but both which I listen to. So they come out on a Tuesday and a Wednesday. So
Hmm.
Tuesday and Wednesday are these little like, here you go. And
Hmm.
then I also really like this British show, Gardener's World. I just love gardening. I find it really grounding.
Hmm. Hmm.
Not to be a silly
Hmm.
pun, but I don't know. It's just like an escape for me. So those things are, I guess, those are my biggest candy treats right now. Has anybody else told us their candy treats? Not yet. So we're looking at you guys. What are your
Hmm.
candy? Oh, we got one. Missy Stuprich says, I'm watching the new Handmaid's Tale when my boys actually sleep. Yes, I hear ya. Whoo! Handmaid's
Yeah,
Tale.
because you
I
can't.
could get through the first episode.
Yeah.
I can't remember when I started it,
Yeah.
but I felt like it was too close to home.
Yeah.
Well, Bridgerton's a perfect segue into some of the questions that have come in on Q&As that you would ask your gynecologist. So should we jump in?
Yeah.
Okay. So this first one is, if you feel like you may have a UTI or a pelvic infection, can
Hmm.
it heal naturally? Is taking an antibiotic required?
Oh, that's a really good question. Um, so the answer is, when you say naturally, I assume is mean, can it resolve on its own?
Mhm.
And so the answer is yes. And that's with really all infections. And the way infections resolve on their own is your immune system fights it off. And so for your vagina, the way it fights it off is by change in pH to get back to that more of that neutral center for the vagina. Um, Bringing in the good bacteria, removing the levels of yeast, and just putting you back into balance. So your body can do that, and you can do things to help your body do it by eating healthy and drinking a lot of water. So maintaining a good lifestyle, not having a lot of carbohydrates, a lot of sugar, keeping yourself in balance definitely can balance your vagina's pH. Also, the vagina. We had Dr. Hairston on a few months ago, and what did she refer to it as? A
Oh,
self-cleaning oven. I think that's what
no.
she
Oh
said.
yeah, self-cleaning oven and no basic vaginas.
Yes, yes, yes. And so you do have, you do go through your cycle throughout the month, and so the pH does change, and so yeah, you can get back to being in that neutral center that's neutral to the vagina. So, um, I had a question earlier today from a patient about vaginal dryness, just to segue from the vagina kind of naturally healing and also nutrition. And this patient is using antihistamines for allergies. We're all in that season right now. Everybody's allergies are going haywire. And so if you need an antihistamine, please take one. Don't stop taking it because of your vagina. But for her, she's starting to experience vaginal dryness.
Mm-hmm.
And, antihistamines don't do anything but dry it up. That's part of the way that it helps you deal with the symptoms that you have from allergies. And so the vagina is just another area where there's mucosa, and you can have vaginal dryness, if you're very sensitive or taking a lot of antihistamines. So remember, going right back to what we talked about hydration, and keeping a good diet. And then also using good lubricants that can bring back moisture, aloe vera gel. Some other brands like Good Clean Love and Restore, they have very water-based um, um, ingredients, and also aloe vera. So that's very good too. But take your antihistamine because you need it. You need it. Just take it.
I would have never thought of that. I love that you connect the dots on that. I just would never have I would have never connected those two things.
But one thing I think we forget, and sometimes I forget that too, us being women, we're still people. We still have the same body systems, and medications can affect our entire body. Mm-hmm. So we are not humans with vaginas, we are people.
So on that topic, before we pivot to some other questions that have come in, how about antibiotics? Are there any side effects from antibiotics that you might notice vaginally?
Mm-hmm. You could experience the same type of thing with dryness. Most women with use of antibiotics. So what do antibiotics do? They kill bacteria. Remember, we talked about the good bacteria in the vagina. Mm-hmm. So it could kill off that good bacteria, leaving that yeast to grow. Many women end up with yeast infections after a round of antibiotics. So it's not a bad idea to ask your provider if you're getting an antibiotic for an upper respiratory something or an infection somewhere else, to say, hey, can you add on a diflucan pill, or to think about doing some over-the-counter medication in case you have symptoms. You don't have to do it as a preventative, but to treat if it occurs afterwards. Mm-hmm. And also, like we just talked about, the nutrition and everything that would help you keep your vagina balanced.
Mm-hmm. Mm-hmm. Okay, so here's a good one. Is there a way to combat heavy periods if I don't want to go back on birth control since I got my tubes tied?
That's a good question. I think it really depends on what's causing your period to be heavy. And mm-hmm. So is it an anatomical issue, mm-hmm. like a fibroid or a polyp? Is it a hormonal issue? You have thyroid disorder, and the birth control pill was just helping prevent you from ovulating, and so that's why you weren't having periods. But is there some other hormonal issue that would cause you to have the heavy periods? So it really depends on what the problem is, and then solving the problem. Birth control pills, patch, ring, IUD, injection, depot, they help to control the bleeding by two different ways, really. One is preventing you from ovulating. So if you're not ovulating, you're not going to have a cycle. And then two is also by helping to thin the lining of the endometrium. So that's what you bleed off every month. So that does become thinner with these forms of contraception. So then if you do have a bleed, you do a withdrawal bleed, meaning you take that week and you don't take the pill. You take that week off from the patch or the ring, and you have a bleed. It's usually lighter because your lining didn't become that thickened during the months that you're on whatever you're using. And so those are the two ways that it really helps with bleeding. But if you have a problem on top of that and you stop your contraception, you still have that problem on top of it unless you've dealt with it. Mm-hmm. So it really depends on what the underlying issue is.
Okay. And this leads me to another question, which is, if you're on your period and you have an appointment with your OBGYN, should you postpone or should you still go in?
Oh, that is a good question. I say still go, because you may have a question you want to ask. And so it's a great time to ask your questions. Mm-hmm. So I say still go. Now, you may be limited in what can occur during that visit. If you're bleeding too heavily, you may not be able to have certain tests done. But these tests are supposed to be able to be done when you're on your period, but in some circumstances, if you're bleeding heavy, I may decide, hey, let's wait until you come back. Or if there was another issue that you were dealing with at the same time, I may say, hey, let's wait till you're not on your period to do the test. But I say still go. It's a visit. The visit's not only for the physical exam, it's also for the conversation about what's going on with your body and your life. And then for me, it's a good time to catch up.
Yeah. And to
So
feel care. I feel like there's something about that just feels like if you have a good provider, if you're lucky to have a good provider, it can be a time of care.
it's a time of care. It's a time of care. Yeah, the physical exam is important. I'm not discounting that in the least. But when you care for the entire person, you're not only caring for their body, you're caring for their mind, and then this also a time just to talk about what's been going on throughout the year if you haven't seen your provider within that year.
Hmm. Okay, so this leads me to this one. What is normal? Speaking of being cared for during that sensitive time, what's normal PMS? And how do you know if it's something more serious?
We all, I think we can all with comfort say that we've all gotten emotional around the time of our period. That's not judgment. That's not saying that you can't take stress or whatever. It just is what it is, right? Um, Bloating, fatigue, that all is part of the premenstrual syndrome. But when it's affecting your day to day, impacting your daily activities, impacting how you interact with people as a whole, that's when it turns into PMDD. So premenstrual dysmorphic disorder.
Okay.
And so that's different. It's a continuum. And so there's some women who have, obviously a higher risk of having PMDD than PMS. Women that already have depression have a higher risk of
Hmm.
PMDD. Multiple ways to treat it, whether you're treating it hormonally with some form of contraception to really just help keep your estrogen and progesterone levels even throughout the month, or you're treating it with something like a SRI or some form of antidepressant medication,
Hmm. Hmm. Hmm.
and then other options too.
Interesting. I'm having a lot of flashbacks to to my childhood and growing up with my mom and her saying, "I can't help it, it's my PMS." And now I know that I'm becoming her. Um, let's see. All right. Um, this one we've kind of touched on, but if there's occasional itching in the vagina, then should I be alarmed? Or how do I know if that's something I need to make a call about or something that I can just handle on my own?
I always say, this is just for most cases, if it's transient and you do something and it goes away, that's fine. If it's something that's persistent, you've made some changes, you've done a couple of things and it's not gotten better, you make a call.
Okay.
You get an appointment, you get it checked out.
Mhm.
You know, not all discharge is an infection. Um, and when we say infection, most people think like bacterial vaginosis, yeast infection, some type
Mhm.
of. Not all itching is due to an infection. Same
Mhm.
thing,
Mhm. Mhm.
So, but if it's something that's persistent, yeah, make a call. You've troubleshooted. Same thing with your computer. You troubleshoot a couple times. It doesn't work. You turn it off. You turn it back on. It's still not working. You need to call somebody.
Yeah. And that's where I am actually on my computer front. I've got a
Yeah.
phone specialist. Okay, so we'll round it out. Let me make sure that I'm not getting any questions on either. Okay, so I've just got a few more that were sent in earlier, which is how often should I be tested for STIs?
Um, it depends on how your behavior sexually. So if you are having multiple partners and you're not using some type of barrier method, you need to be checked more frequently. If you are in a monogamous relationship, you can be checked less frequently. But on average, I recommend yearly. That's for all STIs. So gonorrhea, chlamydia, trichomonas, HIV, hepatitis, syphilis, you know,
Mm-hmm.
um, to consider all those things. And one thing I do recommend is when you go to get tested for an STI, STD, so sexually transmitted disease, sexually transmitted infection, same thing. When you go to get tested, ask what you're being tested for. Because quite often I'll have patients that say, oh, they tested me for everything. Well, what is everything? So this is
Hmm.
part of being informative. or getting the good information on your own health and what's happening with your own body. So what were the tests? And that way, you know, if you're negative for, the majority of the STIs are the most common ones.
So a lot of these questions that have come in are about things that maybe are not so comfortable to ask when you're in the appointment one-on-one. So it's nice. So thank you for creating a forum where people can send their questions in and ask these things. But this one is how, do you have any tips about how to talk to your partner about STIs or STDs?
Oh, that's a good question. That's a good question. I am a very, I try to be upfront with most things. And so, easier said than done. But I believe using clear language is the best. And in all honesty, when you're dealing with that type of conversation in a relationship, I think it's the best to not be accusatory, but just to state what the facts are and state what needs to be done, because that's the first part of the conversation. As far as this is what's occurred, this is the test that was resulted, this is what the recommendations are, this is what I'm doing, this is what recommendations are that you do. And then the second part of the conversation should be the relationship. But getting out the information, I think, is really necessary, and that may be a little easier if you just keep that straightforward, and then have that relationship conversation in addition to it. But that does take courage, I think.
Well, I think that's one of the reasons why I'm so appreciative of this, because just even say, I mean, for me, just to say some of the words that we have begun to normalize through these conversations has helped me alone just get more comfortable taking ownership and not being ashamed of it. And I don't think I got that specifically from my family, but I mean, just in our culture, generally speaking, there is some embarrassment or shame or just feeling like you shouldn't mention these things. But really what it comes down to is self-advocacy, which is, I think, what you've been supporting all along, which is knowing what you should ask of your doctor and knowing what you should ask of your partner and knowing what you should be clear on with yourself or with your children.
Yeah, you're right. I mean, we have a debt that we owe to ourselves, and so that is honesty and advocating for ourselves, for our health, our mental health, our physical health. They're the one and the same. And so advocating for that, and that is really help when we have that knowledge base, and we seek the correct resources.
And to that end, I'm going to advocate for your mental health, and I'm going to call it. Thank you for being willing to sit down and answer these questions, especially after a long day. I really appreciate it, and I know it was helpful to people who had questions answered.
Thank you. I'm so glad to join you again. I'm glad that we're able to do this live this week. Thank you, Hannah.
My pleasure. Thanks, everybody, for being here.
Thanks, everyone. Good night.